Good morning, first of all.
Yes, and good evening to you.
Thank you so much. Well, I see people joining in. Hello, everyone. How's everyone doing? How's your Friday going so far? Let us know. And I think we should jump right into it, shall we? All right, great. Very good evening, everyone. Welcome to Crimson Conversations. My name is Akanksha, and I'm currently a fellow at Painted Red. For those of you who don't know, Painted Red is a nonprofit that's working to end period poverty in India, and we are hosting these Instagram lives and trying to connect to the various organizations around the globe to have more conversations about menstrual health, hygiene, and just health in general. So one of the great organizations that we were able to connect to is Simply the Basics. And Simply the Basics is their mission statement is essentially to provide for the people and communities as well as non-profit organizations the most basic healthcare needs, and so that they can live with dignity and focus on greater goals, which I think is such an amazing initiative. And from their team, we have Megan here with us today. So nice to have you.
Thank you. Thank you. Excited to and see everyone.
Yeah, I can see a lot of people joining. At any point in this conversation, if you have any questions, drop them in the comments, and we are keeping a track of those as well. But before the people ask you questions, I've got my own list ready for you.
Cool.
So let's just go right into it. So many things that I'm learning, and so many linkages that I can already draw between the work that we've been doing and you've been doing. Another very interesting thing that we found out when we were reading up about the work that you've been carrying out is that you've taken up disaster relief operations, right? Specifically, I read about your operations in Haiti and Honduras. So do you want to share some more insights about, what you learned while you were carrying out these disaster relief operations?
Yeah, absolutely. We work with nurses through our partnerships we have with organizations like the Red Cross, like Doctors Without Borders. We're able to get them supplies that they can bring there that they otherwise wouldn't have on site. A lot of people don't realize this, but the Red Cross is this just like phenomenal event planner, right? And what they're actually doing is they're bringing in services from all these different community groups and organizations. So they don't themselves actually have necessarily all these hygiene supplies that they need. So what we do is we make sure that when they're going on site somewhere, they do have those items. So it could be menstrual care. It's often infant care, diapers, baby wipes, any of those needs, so that when you get to a site where you're safe, you also have those products that you need for health and for wellness. And, I think that the way we make this work is again through our partnerships. The fact that we don't just distribute to our direct recipients, but we distribute to all these other channels that are doing great work is the way we're able to reach so many more people in need.
That that's really amazing, especially because I've been reading more and more about how easily, again, this is one of the things that gets overlooked when we talk about disaster relief, which it really shouldn't. We keep missing it. We keep missing menstruation in important conversations, and it seems almost surprising, and yet it happens way too much. And again, the fact that you highlight partnerships so much, it really makes me happy to hear that, because there's so much that needs to be done in these fields. There's really no way that one organization can pull off all of that kind of work. We need more collaboration. We need more partnerships. We need to really build a stronger network for people so that we can just reach more people, right? So that we can learn from each other's experiences.
And I love that you say learn from others' experiences, because um, all of us live with our own life experiences, but we also live, within a certain bubble of those experiences. And so the only way that we're actually going to achieve these goals is from listening to others who've had different life experiences. I think that a lot of efforts make the mistake of not including people in that advocacy who've had those lived experiences. And so through our partnerships, through our ambassadorship program, we really try to bring in voices and an understanding and try to actively listen to people who are there. So, for example, the disaster relief in particular, we learned that we have to so important listen to the people on the ground as well. For example, we were providing support to the firefighters who are working, 20-hour days trying to put out these fires. Uh, and we assumed they would need, general hygiene. But the biggest item they asked for, that's kind of hard for them to promote on social media, is adult diapers. And it wasn't something that occurred to us, but they put on all this equipment and it takes like an hour to put on. And then they have to go for hours and hours. They can't just take it off and on to go to the bathroom. So only by actually listening to them and letting them tell us what they most needed were we able to make sure we were responding in that way. And chapstick. Chapstick was another big thing. Very dry out there.
That is so interesting that you mentioned that, because again, I completely agree with you when you say that we leave so many, like, we think that we know the answers and we completely ignore what the people on ground need, and that's why that conversation is so important, which again ties in, with the aspect of increasing inclusivity when we're talking about a problem like health or hygiene or menstruation. So I want to keep you on this because I'm super enjoying all of the insights that you got from working in disaster relief. So I also want to ask you that how can we tailor the measures, the relief measures, in a way that the needs of menstruators, like we often overlook, are not overlooked, so that we care for them and we can provide them the material that they need in the cases of emergencies.
I mean, such a great question. I learn a little bit every time we provide a service. So if you asked me again in 6 months, I might even have more to offer, more to give. Um, but what I really see every single time is we need to make sure menstrual care is available everywhere somebody menstruates, which is everywhere. When we only provide supplies directly in that relief center or that shelter, what you're doing is you're limiting the people who maybe are unable to get to that site due to transportation. Maybe there's a stigma around it. Maybe they don't feel safe there. There's a lot of shelters where people just might not feel safe, so they're not going to go there to get the supplies, which is why I really believe that we need to make these supplies accessible in public forums as well, in libraries, in city hall, in any bathroom. Every single gender bathroom should have menstrual care. And it should be out in the open. As soon as somebody has to ask you for a tampon, you've created a barrier. So if they're out in the open, if it's something people can just take, so that's something we really encourage. We encourage that, not just with disaster relief saying, hey, can you also get these supplies in other sites? But in school settings, we encourage the menstrual care we provide to be out in a basket in the library and in all of the locker rooms and in the gym and in all the gender bathrooms, and just making sure that it's something no matter where you are, you don't need permission, you don't need to go to the nurse, or you don't need to self-identify. You shouldn't need to self-identify as someone who menstruates to be able to access menstrual care. I also think really important for all relief efforts is diversity of supplies. So not everyone is going to be comfortable using something that you insert, for example. A lot of times there's physical reasons you can't do that. There might be trauma, it might be anatomy, but we should offer a variety so that people have a choice. Plus there's a dignity in choice, right? I'm sure everyone who menstruates has their preferred product. We know what we like to use. We know even the brand. Giving menstrual cups doesn't work for everyone if you don't have access to running water. So we often get those, donated to people experiencing homelessness, but that might not be the best fit if they're sleeping outside. So when you offer supplies, you should make sure that at all those locations you offer it, it is also diverse in the products that you're offering. And I think that that's really, really helpful in making sure that it's accessible and also equitable.
I'm so happy that you've mentioned all of these things. It's just like every answer, I'm just like a little part of me is doing a happy dance inside, because, saying that we need these facilities available in public spaces where you can easily access them, not just in all gendered washrooms, but out in locker rooms, in libraries, because getting that access is tough, and most people don't want to talk about it. And I also feel that if we have these products and the access to these products after the open, it takes away a little bit of the stigma. It takes away a little bit of, the need to whisper to someone that you've just gotten your period and you need this. It just takes away a little bit more of, us wanting to keep it all hush hush.
Absolutely. How many of us hid that product in our, in our pocket or something to go to the bathroom? And seems so silly because we're all using those products.
It's like we're ashamed of such a basic body function, and we do it without even knowing that we're doing it, right? It's just how it's told to you. It's how you've learned about menstruation. And again, the need for making an informed choice. I see so many people saying that, menstrual cups, they're sustainable, they're reusable, they're the next big thing. I don't know, understand why more people are not switching to menstrual cups, but they completely miss the point of, the fact that we have a lot of different products in the market, and while you may have preference for one, that doesn't mean that you can force it on the masses. Yes, you can tell them about it, and I'm very sure that once people start using the right products, they will build up, or they might be open to menstrual cups as well. I've seen that a lot happening in the field. Once you actually tell them that, hey, this is everything that's available, and this is what's good in this and this versus this product, a lot of people I see are also open to trying cups. So it's all about them having that choice, them understanding what they're comfortable with, and not having something forced onto them just because we think that that's the right option for them.
Absolutely.
So I just want to keep this going with, again, bringing us back to healthcare. Now, it's why do you think it is that basic menstrual products have for so long been excluded from public health schemes or policies, even though it's again such a basic thing, probably one of the first that pops into mind, and yet they've still been excluded for so long. They continue to be.
I think it goes back to kind of what we were just saying. There's still a lot of stigma around it. So that's one issue. But a really big issue is that people still often think of menstrual products as a luxury item. And so they treat it as a luxury item. Whereas in, foods, if you have food stamps benefits, you can get Pop-Tarts, you can get energy drinks, but you can't get menstrual pads. So, there's actually this story of how when legislators in America, in this one state, got together decades ago to decide what they would include in their state's food stamp benefits, they made this whole long list of like 800 items, and then they narrowed down to 300 items, and they completely forgot on the 800 items of necessities anything for menstrual care. They just forgot because it was all cis men in the room. It's all people who do not menstruate, and it just completely slipped their mind that people menstruate. And so I think that what is so important there is who's in the room making decisions. And so we need to make sure that we're also electing people that not only represent our needs, but reflect our needs, experience our needs. We need more people who menstruate in public office. And we also, we need to remember that people in public office are there because they listen to us. And so we need to make sure we're getting our voices heard. There is a lot of stigma around menstruation. And so reducing the stigma will help us all feel more comfortable advocating for that need. And I think that, even if it's as simple as making sure that tampons are available in these public spaces, that's a really important start. But all of us can make a call to our legislators. All of us can make sure they know that this is something we consider a necessity and not a luxury.
That, again, brings me back to, we were just talking about inclusivity, and it doesn't just mean inclusivity in the people that we speak to. It also means inclusivity for the people that are making these policies. That's so important. And this is the perfect transition for the next question that I wanted, because again, menstruation is such a basic function, and it's usually not a choice. And lack of access to hygienic menstrual products should not be tackled purely through economic interventions, but also through public health schemes. And yet, so many places, so many countries and states in the US continue to tax a product that is essential for at least half of its population. Why do you think that still happens?
I think that policy only change when we push them to change, when constituents push politicians to change policy. There's a really simple reason why it's not, easy to change, because taxes bring in money. And so we're really pushing our politicians to remove a tax, remove a resource so that we can have a resource. And that's a really complicated thing to advocate for, But I do believe that politicians will do what their constituents tell them to do because that's how they stay in office and that's how they get reelected. So it is up to us to make those calls, to write those letters, and have a shared message. I think that often I see a lot of advocacy happen in a siloed effort. People want to have their name on it. People want to, be the person that solves an issue. But it's actually only when we work as a collective, as a community, with all voices, with all people who menstruate and people who don't menstruate. If you do not menstruate, please still join this effort. Please still join this campaign because it is a public health issue. Public health issues are global. The less people who can maintain employment, who can pursue education, who can support their families and their homes, the weaker our communities are. So this is an issue that really affects everyone. And I'd love to see more people involved in making those calls and doing that advocacy.
And that, again, we come back to the point of, wanting more collaboration, wanting the community around it. And so important to have the allies that are people who don't menstruate in part of the conversation, because when we don't make them a part of the conversation, they automatically end up somewhere being a part of the problem, right? If we don't have the right conversations with them from the start, they might end up perpetuating some of the stigmas, some of the shame that so many menstruators feel every month when they go through their cycles. Because, and I don't think that it's their fault, it's just their exclusion also from these conversations, because we don't want to have these conversations in public. We want to have them in small, tight circles where we only whisper small pieces of advice to each other. Because again, I think most of the time we only deal with it as a surface level issue. Like, yeah, here's a product, problem solved. We don't deal with so many different aspects of it. There's gender, there's your ethnic background, there's race. For India, there's caste. There's so much to look at. And we just want like the simplest fix for the problem. And we just think that if we just throw some product at it, some supplies at it, it'll fix itself.
And I love that you say that because there's so many amazing groups getting supplies out there. But it's, I'm not done after one tampon. So we need to change accessibility. We need to change policy so that these are supplies that are more readily accessible to everyone, no matter the community you live or exist in. Yeah, because one is not enough. Just like one meal will not solve hunger. One pad will not solve menstrual inequity.
That is so true. And I think we do need to start looking at it a lot more with a lot more like angles, right? We need to get more people talking about it. That's why this needs to be a bigger conversation. And honestly, that's like the best way that I could think of to end this. The fact that we need to collaborate more, we need to talk more, we need to do more and be more present in addressing the various facets of this issue. So yeah, if you have any questions for us, I don't see many, but if you have anything, ask us, let us know, because it's been so fun having this conversation with you. I mean, yeah, I really enjoyed it. I so love the work that you're doing.
Thank you. And thank you so much for inviting us to chat. We really want to stay connected. So anyone can find us online, Simply the Basics. But yeah, I think that your message is so phenomenal because it so is important to listen and it is so important to hear from one another. I see a question from Brittany, supporting and getting involved with Simply the Basics. We have ways to get involved no matter where you live on the globe. So if you visit our website, www.simplythebasics.org, there's a support us page where you can learn how to volunteer, how to donate supplies, as well as become an ambassador. We love it when people become ambassadors and you can support from anywhere. And we are similar to your group. We want to listen and we want to learn as well. So if you have something to teach us, please also reach out.
Please take a minute if you've stuck with us for this amazing conversation. Please take a minute, go check out Simply the Basics page, go through Painted Red's page. We'll tag them in a post on our account. Go through our website, see if you'd like to donate to the cause, and let's get better at helping people. Let's get better at listening to people and making better policies.
Awesome. Thanks, everyone.